and this is my first day of my final posting in housemanship. I am so excited. I am so happy. I am so grateful. It's been quite a journey. I remember my very first day of my first posting. Now this is the first day of my final posting, which is my medicine posting. So I'm about to find out what unit I'll be working in the next 3 months. So but this morning I'm just so happy, so excited. Looking forward to those next 3 months and the completion of this journey. So welcome back. If you're seeing this, I'm super glad that you tuned in again and that you're catching up with what we've been talking about so far. And so I am in my medicine posting. Yes, actually today is day 16 of it. I'm just making this video to try and recap a bit of all that has been going on during that period. So day 16, it's been quite a journey. I think last video I made was before I got posted. So I got posted to hemat-onco, that's hematology oncology, meaning that most of the cases that I'm going to be seeing are going to be blood-related disorder. Commonly in this environment is sickle cell disease for the hemat part of it, and then the leukemias, the CML, the ALL, and whatnot for the oncology cases, I should say. So it's been fine. It's been exciting. One thing that will strike you first about medicine posting, and I think one thing that makes it super different, is the amount of investigations that they actually do. Like during this period, I have written investigations I have never written in my entire 9 months in other postings. From SPEP. If you're wondering what SPEP is, don't worry. You are not alone. So from SPEP to an immunofixation assay to a connective tissue disorder assay, several tests. Like you can't actually number it. You could come with one presenting complaint and get like a barrage of tests to do. So that's one thing that stands out. Another thing is the amount of details they pay to what they actually do. Like everybody is so concerned about the most minute. Everyone is in surgery. There's some things we overlook and be like, this might not. But over here, everybody's attention is on the most minute of details, so that would catch your attention as well. Anyways, hematology oncology started good. We started off with 3 patients on the wards. I remember coming and thinking, oh, that's not so bad, 3 patients. And funny enough, everybody that will see me will be like, oh, you're the new person in hemat-onco. Oh wow, such a big deal. Oh, Belel, that's definitely sorry. It must be really rough on you. And I got there, it was only 3 patients, and I was like, not so bad. But then by the next day, we had 4 patients, and by the next 2 days, we had gotten 3 consults in 2 days, and just like that, the patients started mounting. And the thing about this is that we are currently short-staffed at the moment, so I'm the only one on call, the only house officer on call in my unit currently, and it has been, or I should say, it was pretty stressful. Around day 15, I got someone else to join me, so that was pretty cool. But for a long time, all the consults, of course you'd get calls. Like once you see someone, like one of your colleagues calling, you already know there's a consult coming, and that has been super busy, to be honest. It's been good, it's been satisfying. It felt like familiar territory with all the experience I had, because I did pediatrics. I did this same hemat-onco in pediatrics. I did radiotherapy as my secondary posting, so it felt very familiar. Seeing all those cases, the HBSS cases, the oncology cases, all familiar territory. But still, I think it's fair to say that this one is quite busy, if not more busy than those other places. But that being by the side, so I'm just going to talk about 2 major standout cases that I've seen so far. So both of them have been HBSS cases, but they are quite unique in their own way. The first person was a bit older, a high profile patient as it would be. And the thing about working with high profile patients is that even though all the time you're considering what your treatment is, how it comes off as to the patient, when it comes to high profile patients that everybody's always getting feedback from you round the clock, like they take up so much of your time, especially when they are learned, is the amount of effort you have to put in into every single thing. For example, patients, in this kind of category, you find out that they ask you about everything, that they question every single thing. So, for example, you want to take a full blood count. Why do you want to take a full blood count? They're going to ask you, even though you've previously explained, but then if you're doing it more than once or twice, just little things. For example, if you miss a line, to attempt it again is sometimes it's out of the question. For example, this particular patient, I had set her line once. I've taken a sample from her before, but on this particular occasion, one of her relatives were around, and I was trying to get a blood sample, and I pricked her once, and it didn't click. Nothing came out. At that moment, the relative was like, "No, we're not gonna have this. He's gonna call so and so to come and do this himself." And the person he's gonna call is like someone way above my pay grade, So I'm gonna call so to come and do this himself. This, that. But to be honest, they've turned out to be the sweetest people. That particular patient, I am so happy with her progress, because when she came in with respiratory rate of like 40, SpO2 off oxygen was like 86. But now currently she's doing well. SpO2 off oxygen is 96. I just saw her this morning, and you could see that she's all smiles. Everybody's happy, and that's one of the most rewarding things about medicine, when you get to see patients actually get much better than you met them. I want to just skip straight to the next patient, who is a younger person now, a guy. What makes him different is the amount of interpersonal skills or communications I've had to activate in dealing with this particular patient, because he's young. He is slightly more tasking to deal with, if I'm to be honest, because he could come off as a bit rude in the way he speaks, in the way he says one or two things. I've had to actually use a lot of every ounce of patience in me sometimes when dealing with him. Of course, when dealing with him, I believe I've been generally calm in handling, things when they come up with him. But to be honest, sometimes when patients come with what they believe is their own management plan, when they believe what they believe is their own diagnosis, and question everything you do and try to make it look like you're incompetent in what you're doing, while you know that you in that team, with the concern that you guys are giving your possible best to them, it could come off as a bit annoying. But sometimes you give these patients a pass, because they're going through things you never experience. Some of the things you would even never experience personally. So it's not be hard. I think we are cool now. We are getting along more as we get to understand each other. So it's been fine with that patient. So that is pretty much that for medicine posting so far. Super excited I have someone else with me. She's on call today, so that is why I'm able to make this video even today. But that has been pretty much it for medicine posting. Generally super busy, generally very tasking, generally more work, more investigations, more close-up care. But all in all, super good, super good. And I actually like the hands-on. I think I've been more directly involved in the patient's care than previous postings, so that is a big plus on its own. Gotten to learn a lot more big plus as well. Many of the consults that we see, because of the regularity of the cases, in that most of them are either VOC in the known HBSS. Pardon me if you don't know what that is. That is vaso-occlusive crisis in a known HBSS patient, or acute chest syndrome in a known HBSS. DVT, that's deep vein thrombosis, which is one of the most common consults that we get. But then, of course, there is the chronic leukemias, and then a few of the acute leukemias. So that is pretty much it. If there's anything missing, I'm going to put it in there. But yeah, till next time.